And as a follow-up, I'd like to know if the healthcare system will be inundated because now everyone will have insurance that possibly doesn't. Can the current healthcare personnel handle the increased volume because there's no new physicians being trained, nurses, pharmacists, doctors, etc.?
A couple things. ACORN is not mentioned in the bill, and I don't know if they were involved with the draft, and I can't say that. But when our committee heard the bill, we went from 3 in the afternoon till 6 the next morning hearing about it. And one of the things being proposed was that we would set up a group of people that would be government workers like county agents, except they'd be for health care. And they would go out and explain the public health insurance plan to the people in the communities. And I'm sitting there thinking, that sounds a heck of a lot like an insurance broker. And not an insurance company, but the broker. So it's 2 in the morning, and I'm a little bleary-eyed, but I said, well, why are we going to have a government worker do this? And so, well, it wouldn't have to be a government worker. It could just be someone who worked for a nonprofit. And I'm thinking, yeah. So shall we say that within the language, there is that sort of provision which could be seen as enabling that organization like ACORN to have a role. Because they don't want anybody that may make a profit, someone that may be in the private sector. They specifically want someone who works for the government or else is in contracting with the government, and that's where we start thinking of organizations like ACORN. As regards, do we have enough personnel? You know, the crazy thing is that the system we have now wastes personnel. It just wastes personnel. There is a group of physicians, this is what I mean about putting the patient in control. There's a group of physicians in the West Coast primarily, but they're all over. And what they do is they see a patient for $50 to $100 a month. So the woman says, well, and they take care of all their primary and preventive services. And month to month, the woman will go up to them, for example, and say, I would like you to be my primary care physician. Now, as it turns out, if that woman has diabetes, high blood pressure, she needs a mammogram, such like that. Typically now that's going to be 3 or 4 visits because that's the physician gets 15 minutes and she counsels the patient and almost 15 minutes. In their system, they've got to keep that patient happy. They've got to keep that patient happy or next month she'll go to somebody else. And so they, instead of taking 15 minutes, because that's all they can afford to do because they got 30 patients they've got to see that day, they'll block off 45 minutes to an hour and take care of everything. And the patient, in one sense, consumes more time for that visit, but she leaves so much better educated and pleased that she ends up overall consuming less time. Now that's actually transformational healthcare. They find, when they do that the number of tests that their physicians order decreases 20 to 30%. I can tell you why that would be. Imagine the pediatrician and her daughter's graduating from elementary school, and she gets a call at 5 o'clock in the afternoon, and she has to see this patient as an emergency, but she's still a mom. She still wants to see her baby graduate from elementary school, and so the patient comes in, and she tries to examine, but she's more likely to rely upon a test. On the other hand, if that patient can take her business elsewhere, then she's going to have a financial interest. For her family, she's got to also take care of this. Her coverage will be such that that person that comes in at 5 o'clock will be taken care of in a better, more seamless fashion because that's the way they're going to set up their practice, and it's less wasteful. That patient won't go to the emergency room after hours, etc. That's transformational healthcare where you begin to change the incentives for patients and physicians to spend the amount of time necessary on one occasion as opposed to being a hamster on a treadmill running, trying to keep up. I actually think if we change the system to be patient-centered, we'll have enough balance. I really think that.